Hello everyone, thank you for joining us for our low back pain and sciatica workshop sponsored by Physiocare, Rehab and Wellness. My name is Dr. Kwab Ofori. You may have seen me on Facebook or Instagram telling you about the 3 major causes of low back pain. Unfortunately, we are unable to have a live version of this workshop, but we wanted to still share with you some valuable information about some things that can help with your low back pain and sciatica. So please take a look at this video. If you have questions or concerns after the video, you can feel free to contact us. Our number here is 301-782-4600 in the Brandywine office. Enjoy your Saturday and stay safe.
Thank you for your interest in one of the physical therapy facilities that excels in patient care with the most advanced technology in physical therapy treatment. In this video, we will take you through the experience of what thousands of patients with sciatica and back pain have gone through. This experience includes great relief, ability to return to normal activities pain-free, strategies and techniques to be able to address sciatica pain if it returns.
Okay, how many people saw this thing pop up with the young-looking, handsome 40-year-old man? Yeah? Okay. So how we came about this is we started to see an increase in the incidence of sciatica and low back pain in our practice. It somehow ramped up over the last few years and became a real problem that we had to help people with. And so we decided that we wanted to not only treat people that have that particular condition, but also educate them about it, because it's very important for you to know why what's happening to you is happening, right? So we're out in the community a lot. You know, we do health fairs, we do career days, we do different ministry events at churches and things like that. And so we see tons and tons of people who are going through the same thing. And I gotta say, out of all the conditions that we do see, low back pain and sciatica ranks up there just right about number 1. And so we wanted to kind of attack that from an educational standpoint, and hopefully later on down the line, we get the opportunity to help you resolve those symptoms, okay? So did everybody get a copy of the worksheet? Good. Yes. And we're going to be going through that worksheet today to answer some of the questions on there. And please, I also want to tell y'all, if y'all have a question along the way, feel free. Ask the question. It's an interactive workshop. We'll be doing a lot of interactive. And you see, we're a very digitally based program, so a lot of visual input as well, okay? So, who here is experiencing low back pain or sciatica now? All right. How many people are in denial? No, I'm kidding. No. It is a very serious deal. It's something that I've personally experienced before. Family members and obviously a ton of my patients have experienced before. It's a very painful condition. It can be very debilitating. And so I know what you're going through, and the idea here is to help educate you and lead you to the steps to help maybe resolve that, okay? So, by another show of hands, who here is really serious about resolving their low back pain? Yes, yes. It is something that everybody wants to do, because it's not fun to live with, and it can really stumble your lifestyle, okay? Again, we decided to do this workshop series because of this low back pain epidemic, and what I believe is that over the course of the last maybe 10 to 20 years, we've changed our lifestyle in a way that's maybe more sedentary. I think computers have a lot to do with it, right? Our bodies really haven't changed over the course of the last 1,000 years. You know, I mean, if you go to LA, you might see some different things. But for the most part, we got 2 arms, 2 legs, head and neck, right? And so that hasn't really changed. So it's like, why is this incidence of sciatica increasing, right? And I think it's because we have more computer-based or desk-based jobs right now, so we're sitting a lot, and sitting is probably the worst thing that you can do for your spine, because you have no support underneath you. So you're sitting right on your pelvis, or what we call the sacrum. And so you get a faster degeneration of your joints and the discs that are involved in the spine. And we'll go through the anatomy of the spine in detail here, okay? So what is sciatica? So the root word sciatica comes from the Latin word ischiatis, okay? That's an old word that pretty much means your pelvis. We also name the pelvis the ischium, right? And it literally means pain in the hip. That's where the word came from, okay? And although it does not necessarily originate from the hip, that is where most of your symptoms are felt, okay? So when you have numbness or tingling or heaviness or burning in the leg or even located right at the hip, it's most likely you have sciatica. There's a number of other things that can be going on in the back, but when you have what we call those radicular symptoms, it's typically a low back pain with sciatica symptoms, okay? All right. So in the body we have two sciatic nerves, and this is a general overview, and I'm going to introduce somebody very special to help us break down the anatomy of this particular body part. But in general, there's two sciatic nerves, one on either side of the lumbar spine, travels down into the hips, down the back of the legs, and into the foot, which is why sometimes many people can feel those symptoms all the way into the toes, and that's not a good feeling, right? Okay. Before we continue, a little bit about myself. Again, my name is Dr. Kwaba Foriansa. I am a doctor of physical therapy. Okay, I went to the University of Maryland, College Park, and graduated with a degree in kinesiology. However, my background is in electrical engineering. Don't figure that, right? But I like to tell people that the body is the most complicated machine in the world. So I kind of took what I learned in engineering and just transferred over to the body, and it's worked out. All right. Also went to the University of Maryland, Baltimore Medical School, where I graduated with a doctoral degree in physical therapy. Believe it or not, y'all, I was slated to be a drummer, right? I love music, and I've been playing music my whole life, and I thought I was gonna be a rock star, right? And I'm glad I didn't, because I got great parents, and they led me in a different direction. And the good thing is, if I had become a drummer, I might have been in a little bit of turmoil, because the two people that I auditioned for are in the news in a not so good way. Last name Usher, last name Kelly. Okay, I'm gonna leave it at that. Okay, but in any case, I evolved into what we call a manual therapist. I had great mentors that taught me how to use my hands, even though my parents are the ones that got me into using my hands, because they used to call me into their bedroom about 10 o'clock every Sunday night to massage their feet and their knees, right? But it worked out, because I got to learn the body that way. I got to learn how skin feels, how muscles feels, how tendon feels, and I never forgot that, and I think it helped translate into being a great manual therapist, okay? I want to introduce to you a good friend of mine. His name is Dr. Mauricio Salazar. We actually have reconnected after a gap of about 18 years. Fate has brought us back together.
I love lumbar spine. The reason why is because I suffer from lower back pain. I was in 3 car accidents. None of them were my fault. I was rear-ended 3 times, and I was in a massive 5-car collision at some point. In those days, I was in undergrad, so I was a personal trainer, and I would try to help myself through exercises, and it was very hard. I started experiencing severe pain in my back, and then down to the buttock area, and it was very debilitating. I went through undergrad in pain. I couldn't sit for long periods of time to study, and bottom line, as a personal trainer, I wanted to know more about how can I help myself. So I decided to go to PT school. My goal was to open a preventive medicine center in those days. And I researched what would be the best 3 letters after my name that I can open a preventive medicine center. And since I was specializing on the elderly population and exercise, I wanted to do something for the elderly all my life, because I had a great relationship with them. I used to teach in merengue classes. Have you guys done merengue before?
Yeah.
So my classes, I was the first guy actually in this area that taught merengue classes 10 years ago, before even Zumba started. So it was great, and I wanted to provide something for the elderly. So I decided to go to PT school. In PT school, I continued suffering from for low back pain. I started taking anti-inflammatories. How many of you guys have taken anti-inflammatories? Right? And I decided to finally see a physical therapist. Unfortunately, I have to say that my experience with a physical therapist in those days were not as pleasant. They barely put their hands on me, they gave me some exercises, but I was already a personal trainer, so I was like, what am I doing here, right? My pain, I would say, it went down maybe a few notches, maybe from a 7 to a 5, but I continue having pain. I went to PT school, and I said, okay, so what is going on with my back? Why do I take anti-inflammatories and I still feel pain? Why I do exercises and I still feel pain? Why I rest, and even resting I feel pain? You guys are related?
Oh, yeah.
So I was like, what can I do to actually help myself? So I dig into the lumbar spine. That was one of my weakest, but my favorite subjects, along with shoulder. But I started wanting to learn more. What was happening there? It ended up that I had a herniated disc. How many of you guys here have a herniated disc? So the mechanics of a herniation that we're going to talk about in a little bit is very important, because you have a disc, right? The disc is in between our vertebral spine. You can take a look at this. Discs are right here, and it provides cushioning, right, to our system. The problem is that the compression in between these discs, when you sit down, it goes up to 80% more compression. And when you bend over, it goes to 90% more of compression. So a lot of us have got brain injury, picking up some stuff from the floor, or carrying boxes, or moving. So there you go. You have that particular disc that at some point, because of so much compression, the inner part of the disc, that is funny name called nucleus pulposus, don't worry about that. It's a gel-like structure. It will push into some ring-like structures, and it will create this herniated disc. This disc, usually, it will affect the nerve because it will become impinged. Do you see this? And then, since this nerve between L3, L4, and L5, and S1, S2 is the formation of the sciatic nerve, it doesn't matter at what level that this impinges the nerve, you will start having those radiating pain going down the leg. So when I have a patient, I say, what kind of pain are you having? Well, I have sharp pain down my leg. I have radiating pain down my leg. I'm sleeping. After 2 hours, I wake up. Or when I wake up to turn around, I get a jolt down my leg. So what can we do? I spoke to a few colleagues of mine because I was really frustrated. It's like, well, we need to kind of put an end to this pain. I was too young. I'm still young. I was too young to be able to have these issues. So I started seeing what kind of treatment would be the best for me. And I started doing some journal studying also. It ends up being that monotherapy is one of the leading treatments for back pain, along with exercise. I had not seen a monotherapist when I went to physical therapy before. It was only exercises that they actually prescribed to me. So between my friends, I started asking them, can you practice with me whatever we're learning at school? I want you to be able to help me. And I started seeing that change. My pain went down to 3, it went down to 2, and by the time I finished PT school, I was pain-free. I went back to weight training. I was a personal trainer. I went back to do many activities that I was doing before. So the mechanics of how our body is composed, or how our vertebral spine is very, very interesting. Now, the sciatic nerve, right, as it comes down through the pelvis area right here, and it is compressed from the superior aspect of the beginning of the ramification of the sciatic nerve, is only one cause of back pain, only one. We also have another one. Well, my patient said, well, I did an MRI and I don't have a herniation. So why am I having this pain going down here? Where is it coming from? Well, there is other sources. And what are the sources? It's a muscle that sits right here. It's called Piriformis Muscle. How many of you guys have heard about the Piriformis Muscle? You've heard of it? Mm-hmm. Right? And some of that, it turns out to, actually they gave a name to the condition. We're not going to call it sciatica, we're going to call it Piriformis syndrome. It's kind of the same kind of thing. Because the symptoms are kind of the same. Debilitating pain. Right? How many of you guys get pain, let's say 7 out of 10 pain level, daily? Raise your hand.
Past that.
So it turns out that, you know, at this point, we need to do something about it. And the way that I started treating myself was, number one, I was helping myself through manual therapy. My friends, I was their dummy. He says, can you treat me? Can you practice on me? And I was getting treated like that. And I started studying a little bit more in depth in regards to what muscles I should be exercising. So this disc is not really affecting my back anymore. And I think I'm gonna leave it at that. Those secret muscles, it will come a little later, right, Dr. Ofori? He'll continue and then we'll come back to tell you which muscles are the ones that you should be exercising to help this disc stay stable.
Question. The piriformis muscle, it meets where the back comes down, where the glute starts, glute muscle.
Exactly. So basically the glute muscle is a big muscle, right? It's right. It allows us to extend our hips. But then you have a deep muscle, like you said. It allows to abduct our leg and also externally rotate our leg. And that muscle is located right here. It goes from the inside part and it bends out. So basically it comes like this. And as the nerve, and I'm going to show you on my 4D, actually let me show it to you right now. Let me see if we can get that up in the screen here. Okay, so I like to explain my patients what is going on with them because I feel that if they understand their condition, they'll be able to do something about it. If I tell them this muscle is located in this position and that's why you need to exercise it, and this is what you have to do to exercise it, guess what? You'll exercise it. Why? Because it will work. As simple as that, it will work. So we were talking about the piriformis muscle, right, ma'am? So let's look at the piriformis muscle here. And let's see here. Oh, that's where it is. So you can see where the piriformis muscle is actually located. It starts from the back and it comes right across. You guys seeing that? Yeah. So through manual therapy, we try to go deep. So why is that muscle so important? Let me show you why it's so important. Let's kind of put here sciatic nerve. Ooh, look at that. Look at where the sciatic nerve is located. See? So when somebody's sitting for a long time, or somebody's walking for a long time, people say to me, you know, I walk a block, I'm fine. I walk 2 blocks, I'm fine. But at the 3rd block, it starts going on right now. And I can't get rid of that pain. What can I do about it? And I don't have a herniation. So guess what's happening up there? That piriformis muscle is doing something to that particular nerve, the sciatic nerve, that is debilitating the condition of the leg. My teacher used to tell me muscles are dumb. And I said, what do you mean? He'll tell me because without nerves, they cannot function. So you can have a nice glute, a nice quad, but what happens with that connection between the spinal cord and the muscle becomes inhibited. Can they work? No. So if somebody has stroke, unfortunately, they can move the leg. It doesn't matter how much massive their legs were before. So it's the same thing. That nerve gets angry, and it gets all these symptoms down that area. Did I answer your question? Mm-hmm. So basically, that's what it is. Any questions in regards to the anatomy of the lumbar spine or the nerve before we continue on? Any questions?
Yep. Okay. Perfect.
Let me go back to that.
So we're going to take off here, okay? The question we like to ask first is your pain reproducible, right? Meaning that is there an activity that causes or elicits that pain? Is your pain reproducible? Do you notice it at certain times during the day or certain activities, right?
Yes.
Okay. Do you have pain with standing, walking, right? Sitting for long periods, lifting, right? Laying down, laying on your stomach, laying on your back, getting in and out of the car, right? Okay, getting up from sitting. Those are things that people typically have issue with, right? Basic everyday functions that can cause that severe jolting pain. Here's the single biggest mistake, okay? Sciatica and low back pain sufferers, the number one mistake they make is they ignore it. And what I mean by that is they go days, weeks, months, and we see in many cases years and years just either hoping the pain would go away or doing other things to kind of help numb or make the pain dormant, but not really getting to the root of the issue. The body's a machine. It's a structural unit. So just like you have a car, right? Even the finest car. I drive a Maserati. I'm kidding, guys. I'm not there yet. Okay, I'm living my best life with my Accord. Okay, but it is a machine that requires fine tuning. It requires great alignment. Right? We're talking about the spine here, and if it is not aligned, if it is not well oiled, if it is not running at its highest efficiency, then it's going to develop problems. I never forget, you know, I had old cars my whole life, and the first thing the mechanic wants to offer me is an alignment. Like, okay, how much is it going to cost? $119. All right, okay, I'm broke. I don't have $119. But all of a sudden, everywhere I go, my car is going like this. It's pulling to the right, or it's pulling to the left. Now, if you imagine that happening in the body over a number of years, that's going to cause some issues, right? You may pull to the left. You may pull to the right, right? And so we want to fix that alignment, right? Okay? So one of the other things we do, we talked about anti-inflammatories and medication earlier, right? We want to numb the pain, or we want to have a temporary relief, but it doesn't solve the problem, right? We want to get it done. We want to come to a place where we can actually resolve these symptoms, right? What I want to focus on, this should be on your sheet, are the most common causes of low back pain and sciatica. We talked about a little bit of this already when we went through the anatomy review, okay? Number one, herniated disc, okay? And just to review, we have the lumbar spine here made up of 5 different joints and these discs in between those joints. And we talked about how that disc, over time, it gets smaller, it gets less moisturized because there's actually water in these discs, and over time, those discs flatten and they can leak out or they can move out and touch these nerves that go down into your leg, okay? So that's one of the reasons. The second one is what we call spinal stenosis, or Degenerative Disc disease, or arthritis. So those are conditions in where there's some type of wear and tear of the spine. The spinal cord sits in a canal, and as we get older, that canal tends to shrink a little bit, okay? And that can cause some impingement to your nerves that run down the legs. Also, between the joints, there's cartilage, right? And the cartilage can wear down. How many people have heard of arthritis, right? Or old Uncle Arthur, right? Okay? All that is the wear and tear that occurs between the joints. You have a fine, smooth cartilage when you're in your 20s and 30s, and I'm sure you guys are just right about there, right? But that wears down, okay, and that can cause some issues in the spine, all right? And then the last thing is when we talked about the pelvis and how that's situated, that pelvis can many times go out of alignment. This is your pelvis. These two winged bones here on either side of the spine, right? And in between sits a plate-like bone called the sacrum, right? And these three bones need to be in harmony in order for your back to move well and to move in the proper mechanics. But I tell you what, I'd say probably about 9 out of 10 people have that area out of alignment. So what our job is to teach you and to actually use manual therapy to help get that back into alignment. And you'd be surprised, I've had patients who have realigned their pelvis and their sacrum and their symptoms completely went away instantaneously. Because what happens is, we saw where the piriformis lies, we saw where the sciatic nerve comes down. If that rotates backwards, or if it rotates forward, or if it slips up, immediately what that does is jolt on that muscle, which jolts on that nerve. Okay, super important. There are different treatment programs for lower back pain in the 3 causes of sciatica. Doing the right ones to address the cause of your pain results in permanent relief. Somebody say permanent relief. Permanent. Permanent relief. We want it gone, right? So bend forward, okay? How many people are feeling a little something doing that?
I do.
Say ah. Oh my gosh, that's just about everybody. This is going to be hard, Dr. Mo. Come on up. Okay? All right. Let's place your hands on your hips and let's extend backwards slowly. How many people are feeling that? Oh my goodness. Okay. All right. Hands to the side. Let's slowly bend to your right. Okay. Any discomfort with that?
Yes.
Yes. Ooh, yeah, we don't like that. What about going to the opposite side? Okay, not as bad as the right side. So that would typically happen, you know, when you're experiencing low back pain and sciatica, one side usually hurts more than the other, right? So if you bend to that side, typically you'll feel more pain. If you bend away, you probably feel a little less pain or no pain at all, okay? All right. Please have a seat. When I'm treating a patient for low back pain, really of any kind, but particularly for sciatica, is we want to realign the pelvis and the sacrum, okay? So that's what we're going to do now. And how we do that, it's nothing fancy, it's nothing, there's no magic wand. We're using the muscles of the body to help draw the bones back into the proper alignment, okay? And that in itself can be a little bit of a relief, right? And then after that, what we're going to do, we're going to have Dr. Mo do what we call a muscular release on her of that piriformis muscle we talked about there. Okay, you know, we're not going to go hard on her because we do sometimes have to get to an uncomfortable place to get that deep muscle because we saw how deep it is, right? You have your glutes all around this area here, so we go a little deep, but even a little bit of pressure can bring some relief. Okay. And then lastly, what we'll do is we'll go through the anatomy of the muscles that surround the spine that you need to strengthen in order to stabilize the spine. So when you're moving and even when you're stationary, you have the stability to not have that pain, okay? So what I'm gonna do, I'm gonna check out her alignment first, right? And I can almost guarantee she's out of alignment. And I'll tell you exactly where she's out of alignment.
So we all are going through the same path. At some point, we're going to get osteoarthritis. At some point, our disc will desiccate. At some point, something will happen in our lives that actually will cause back pain. It's how we address it. We cannot really stop the osteoarthritis from occurring because we're getting older. But we can stop the process. We can slow down the process in a way and that can allow us to enjoy life. That's what we want, right? We don't want to be sitting there scrolling and trying to put attention when you have pain, right?
Absolutely. And that's a wonderful depiction of how that works, and it gives a clear, you know, kind of visual as to the shortening of the disc and the loss of moisture. And what we need to do, we need to reinforce that area with some musculature, right? Okay, and we're going to get into that right there. Okay, so this is not good, guys. This is not good. Right? Okay, so she just raised her leg about 30 degrees and she had a significant amount of pain. All right, okay? That's what we want to
Very uncomfortable laying like
laying like this, okay? So I want you to raise your knees up here. A little bit more. Does that take pressure off of your back?
Yes.
It does.
And that's right here.
Right in the buttocks, right? Okay. Okay. Stretch your knees out for me one more time. Where do you say your pain mostly is? In the left leg, right?
Yes, and right in my back
Yep.
right now in my hips.
All right. So already I can tell that her left leg is rotated. I mean, her left pelvic is rotated. And it's because if I measure her right down here, her ankles, it's supposed to be like this, right? And on her left side, it's raised up. It doesn't mean that she was born with a short left leg, right? It just means that her hip and her pelvis is rotated backward, so it pulls up her left leg, creating what we call an apparent leg length discrepancy, okay? All right, so we're just gonna do a small little technique here, okay? And see if we can fix that, all right? Let's bend your knees up here, good. Okay, I want you to push out against my hands here, okay? Just gently, okay? Count to 5, 4, 3, 2, 1, relax. Good. Take your time. Again. 4, 3, 2, 1. Relax. Good. Let's pull up your left leg here, right there. Can you push into my hand right here? That's okay. That's okay.
I'm trying.
All right.
It's not working for me.
That's okay. Can you raise your knee up towards your head? Just like that. 1, 2, 3, 4. Breathe. 5. And relax. And
Oh, this is hurting.
it's okay. Take your time. One more time. 1, 2, 3, 4, 5, and relax. Okay? Good. So you can see she's in a lot of pain, but just that little bit of motion has evened out her pelvis. So that means she was walking around, and you can come up to her.
One thing that I do is maybe spend 10 to 15 minutes with my patients when I do the evaluation is to see what is really affecting their symptoms. And one of the #1 causes is poor postural control when you're in bed. Or what kind of bed you're sleeping on, or what kind of things you're using to sleep, right? So all the commercials that you see on TV, they're true. I know they're trying to sell their product, but all those things that you see on TV, in which they show a vertebral spine, somebody actually laying like this, and how the mattress is going into the system and trying to provide that stability is true. Now I can tell you, usually I have a preferable mattress that I recommend my patients because my mother suffered from hip pain for years. And after we treated her for a long time, she wouldn't get better. So basically what I said to her is, Mom, when are you feeling the worst pain? She said, in the morning. And as the day goes by, it gets better. But in the morning, it's horrible. So I started making a journal for her. I will call her, I will text her and say, do you have pain right now? She says, no, I'm feeling fine. Call her at 7 in the morning. Do you have pain right now? Yes. Did you just wake up? Yes. Did you do your exercises that I sent you to do? Yes. Something was not working. She just had purchased a new mattress from Macy's. A $3,000 one. And I said, Mom, it's a mattress. Because we're doing everything we can here manually with exercises and you're not getting better. And you're telling me that you are, in the morning is the worst pain with something going on during those 7 hours that you're sleeping. So she said to me, well, I'm doing everything you're telling me. I'm putting a pillow between my knees. I'm trying to make myself align, but I said, that's not enough. You have to change your mattress.
Was it a firm, soft, plush? What kind of mattress was it?
It was a soft top mattress. You know they have the extra soft layer on top. The foam one. So I said, Mom, I want to see. So I talked to my sister, and I said, well, we're gonna sell it. We sold it to my sister, and my sister used it for their guest room. So I guess it will be good because the guests don't have to stay long time. And I did some research. I went crazy trying to find out from my mom what was going to be the best one. And according with many researchers, they see that the number mattress, and they're not paying me to do this or anything like that. The number mattress is one of the best mattresses out there. It's called the number mattress, in which you can pick how much how much firmness you want here. You can pick how much firmness you want there. If it doesn't work, I have a second option. Second option was the Tempur-Pedic mattress. And the Tempur-Pedic mattress will basically align, it will align your spine more comfortable than the number mattress. So we can pick and choose, and sometimes even it's a trial and error, but what the majority feels like, and sometimes it takes time to get used to. People tell me, what is the best pillow to use? I have my preferred pillow, and I usually recommend for cervical patients the Tempur-Pedic pillow. But it's going to take a while for you to get used to. If you used to sleep with a feather pillow or with a sponge pillow, and then you go from that pillow to a Tempur-Pedic pillow, you're not going to have a good night. You need to work yourself to it because it's a hard pillow. But once you go through that trial period, believe me, you go to hotels and you're going to be carrying your pillow because you cannot sleep with their pillow. You will see a difference. But anyway, let's go back to this. So, can I leave this up? Can you loosen your belt just a little bit? When I was in Georgetown for 8 years, and I had the privilege to be able to talk to gurus of back care. There was a lady there that when I graduated and I was doing my internship there, she took me in. She was a back specialist for Georgetown University Hospital. Amazing lady. And she showed me a lot of things that I think it will help my patients. After that, I was able to take a lot of classes, continuing education classes from manual therapy. And I start seeing the difference in my patients as I was actually doing some manual techniques in them. So the first thing I do when somebody comes here with pain, I try to, number one, determine where is the pain. So you mentioned it was right in the center, right?
Yes.
So I do a palpatory examination first. You tell me if it's tender or I'm touching right now.
Not a little bit, but just over to the left, or over to the other way.
So we're over to this side.
Yes, down and there. That's where it hurts at. When I'm sitting a certain way.
And over here is not doing that bad.
And right there.
And right
That's
here.
where it starts, and it goes from back there all the way down
Okay.
my left leg.
Okay.
Guess what muscle that is, guys?
You talked about it, right?
Yeah, begins with a P. Piriformis.
The first thing I do is I try to determine what area of the piriformis is actually she's having pain. So I'm going to put my hands inside. Is that okay? So I'm going to go in there. I'm going to go in there, and I'm going to see. Can I share with them what I'm feeling here?
Yes.
Okay. So a lot of tightness, a lot of myofascial restrictions, and I even feel some scarring underneath. You see these bumps here? Can you feel this? What I'm feeling right now? Those knots.
Is it knots, right?
Yeah. Sometimes when it gets to a point that it becomes very, very painful. So when I see a patient for the first time with this type of pain, I try to isolate the area first. And here at Physiocare we have wonderful techs that we prepare the area prior I get to the patient. So they're going to do some E-stim, what is electrical stimulation, very soft. We're going to do some moist heat. We'll tell you wonderful things. We prepare you emotionally and physically. By the time you get to us, you'll be ready. So right now we're kind of doing a crash kind of treatment here, but for you to see. I believe in the power of the manual therapy. I've been a believer because I was one of them that actually got healed by it. So I start feeling around here. So what the patient will feel is some pain, slight discomfort, and I sustain the pressure there for about 20 seconds. And I start kind of looking at it, what is more restricted. And you're going to feel right now that if I move to an area, your pain is going to change. Can you feel this? Can you see how it changes from here to here? So wherever it is more painful, I kind of lower the pressure, but I go towards that direction, and that's what I do. And of course, you know, we do hands-on 10-15 minutes trying to resolve that issue, and it comes not just in one-time basis. So we do superficial tissue first. Our second session we do the second one. In our third session we start going deeper in layers. We want to be able to get out of here functional, be able to, you know, walk around and feel better. but the first time is like this. Once I do this right here, I do something that I call an elongation. So I'm gonna do it right now. I'm gonna lower this a little bit more here. And patients like this one because I'm not poking on them like I was in the beginning, but I was more like just going to.
So what he's doing is he's using his hands to gently stretch out the muscle in the fascia, what we call fascia. That's the kind of the tensile sheath over the muscle, to elongate it. We talked about how muscles are innervated by nerves, and once the nerves get to kind of a happy place, that muscle slowly begins to relax. And that piriformis muscle is the main muscle we want to relax. And it takes time, but on the first visit, you will feel a tremendous difference. Like we said, people ignore their pain and they're walking around 2, 3, 4 years, and it kind of gets to a point where it's almost like a rock. And so you go in there and there's things that we do to help release that pain that has been there for so long, okay? In this particular procedure, we call it Piriformis Release, all right? It can be a little uncomfortable at first, but when you stand up, when you get up after a few times, you start to see the change. And that's how we help people with that particular pain. Sure.
So when you're going through this therapy and you have a manual process, is there something you can do at work since you're still going through the treatment to help alleviate the pain?
That's a great question. So we use a number of different home modalities that you can use at work or at home. First of all, the first thing we do, we give you an exercise program that you can use at home or at work, right? So that there's things that you can do to help stretch out that piriformis muscle while you're at work. Just simple things. Something as simple as getting up frequently can help you alleviate some of the pressure on your spine throughout the day.
When the joint has tell the brain, stop working on this area because there is pain there. We don't know what that is. We don't know if there is an infection there. So start pulling into this area. So a lot of those muscles become inactive. Here we call it in physical therapy, neural re-education. And we need to re-educate those muscles to start activating again. To at some point, you don't have to do those Kegel exercises anymore. So for the guys, what is a Kegel exercise? Basically, you hold the flow of urine, pretend that you're holding the flow of urine, and you hold it for 10 seconds. And then you gotta do at least 10 repetitions with a 10-second hold. Do it very subtly, very, I would say, it's very short contraction in the beginning. Don't do too much. The problem also with this exercise, and people tend to hold their breath. So my recommendation is when you're doing this one, count out loud. 1, 2, 3, 4. Now there is more to it than just doing that. And I will tell you when you come through our evaluation process, and we can kind of discuss. There are many ways to do that here. That's one way to do it. But there's also here we have wonderful text that will show you many other ways that you can actually activate that particular tissue. All right? So I guess I'm good.
Let's give a round of applause for Dr. Mauricio. An area, you're actually making it looser, right? And we've shown how stabilization is more effective than loosening the joint area. When you go get your car aligned, it doesn't take 5 seconds, does it? No. They put you on a machine, put you on a rack, and they slowly change the parameters for your alignments of your wheel and your axles to get back into the proper position. That's much more like physical therapy, right? It's a more comfortable solution, in our opinion, and it's a more effective solution because we're just not going to change your joints and muscle alignment, but we're also going to give you the strength and the control to help you move better. So, right. So we see chiropractic patients all the time. And no people on chiropractors, they have a place on what they do. And you know, we also do some of the same things, but we don't use them, but because we see that other things are a little bit more effective, particularly for this situation. Okay? Any other questions? Please feel free. Yes?
For those who suffer with fibromyalgia, do you find this to be effective?
Well, fibromyalgia is more of a global and systemic issue, right? A lot of people carry it in the neck and or in the back, and some people have it all over their body. Now, the manual therapy does work really well for fibromyalgia because what we're trying to do is desensitize or bring down the activity of the nerves that are causing the pain in those body areas. So for us, we're trying to steer you away from what Mr. Doctor is going to get you to get at CVS and get a more natural and a more consistent relief pattern for that particular condition. So yes, to answer that question, we see fibromyalgia a lot.
What
Yes,
if you
ma'am.
have difficulty with your legs? They're weak and you can't walk very far.
Right. So that can be coming from a number of different things. There's a lot, which is why we would do an evaluation on you to see where that's coming from. But if it's related to your low back, it's because, as we saw, those nerves that start in the spine, they actually run into the legs, right? And so if they're not working properly or if they've been short-circuited, you will get weakness. We talked about having dumb muscles. Those muscles, if they're not being innervated by those nerves properly, then you can't walk far, or that you can't get up from sitting. So it's a common thing where we will show you how to reverse that and strengthen those muscles before it gets too bad. Hey guys, thank you for watching the low back pain and sciatica workshop video. Hope you got some valuable information from it. It's only the tip of the iceberg. So if you need to speak with a doctor of physical therapy about your low back pain or other issues that you may be having in your body, please contact us. You can contact us by phone, 301-782-4600, or you can contact us on our Facebook page directly. In any case, we hope that you're staying safe, and we'd love to see you and meet you soon. Have a good weekend.